today we have a lot of high school students, and you know, and the farthest thing from their mind is probably health. How many high school students go get your physical every year? Raise your hand. All right, we got one. He probably plays sports. He has to go get his physical. That's okay. But what I do is I tell those stories, and as Mr. Taylor was saying, I write for the Clarion Ledger. I recently wrote an article about a young man that came to the doctor. And he came to the doctor for his physical, of course. And it turns out that when you get your physical, you got to do a test to check your vision. And his vision test was not quite as, he didn't quite pass. So we referred him to get some glasses, and his mom was very concerned. She was like, look, we didn't come for all that. We just need the letters so he can play sports. I said, man, but he might get hit in the head with a football. You know, he can't see as well. So the kid went and got the glasses. And it turns out he came back to see me a little later. And his mom was so excited because part of the physical was also counseling, adolescent counseling. It turned out, it was revealed that his grades weren't very good. He was very concerned he wasn't going to be able to play because you have to have a certain average to play. Well, the child went and got his glasses and came back, and the mom was so excited because his grades had just shot up. And it turns out that child couldn't really see the blackboard. Couldn't see the blackboard. But now that he got the glasses, he could see, and his grades are going up, and the mom was telling me how his confidence went up. And I remember doing the initial assessment, I asked him what he wanted to be, and he said he didn't know, but now he wants to be a doctor. So, you know, that's just an example of, you know, the responsibility that we have to go get the physical, to go get checked out. Because this child who wasn't really getting his physical, he hadn't been to the doctor in the last few years, came in and got a physical. Turned out he couldn't see that well. And when you have a child, you know, a high school student who can't see the blackboard, it didn't just happen overnight. I mean, it wasn't like yesterday he went and just reading the board, then the next day he can't see the board. You know, most medical conditions are progressive, and they get worse and worse and worse over time. But the way it works is you never really realize it because it's just a little bit day by day. You know, in my articles I use analogies, and I talk about a car I once had. It was a Mercedes. This was when I was in LA doing my residency. And when you're in LA, you gotta have a Mercedes. Okay? You're a doctor, you know. But the deal is, I didn't have doctor money because I was just a student. So, you know, I went and bought a old Mercedes, and probably, you know, I paid cash for it, but it didn't run very well. But the car had a little light on the dash. And when the light comes on, you're supposed to take the car to the mechanic. So the light would come on, and I'd take the car to the mechanic, and I'd pull up there, oh, it's Dr. Quinn. Okay, yeah, come on in, Doc. And they charged me like a zillion dollars, which I didn't have. So I'd get the car fixed, but I remember the light came on another time, and I would drive around, and I decided, you know what, I'm not gonna go. I'm just not gonna go. I'm gonna keep driving, and I'm gonna ignore that light, okay? And that light would come on, the car was driving by, it might make a little sound, and it's all right, we'll just keep rolling, you know? And then a couple of months later, the car just broke down, okay? So I had the tow truck to come get the car, and took it to the mechanic, and they basically asked me, you know, they said, you've blown the whole motor out. And they told me, they said, well, didn't the light come on and let you know you're supposed to bring it in, and did it make a funny sound? And I said, I was sure it was going to be okay, and I just ignored it and just kept on driving. Well, guess what? I didn't have a Mercedes no more, okay? And I use that story because not to compare the body to a car, but see, God is real. And what he does is he gives us little warning signs. Like you have an individual with high blood pressure. You know, they feel good. You know, they still can go play basketball like my dad. He thinks he still got it, you know. He got there, but, you know, you might jump up and you feel a little dizzy. Are you going to ignore it? Or are you going to go get it checked out? You see, that's like that light. That light came on. Yeah, I ignored it. Just kept on going. You know, you might get up in the morning and your head is hurting. That's like that light on that car saying, go get checked out. But as Christians, we have a responsibility, because our temple that God has created, is trying to let us know we need to go get checked out. But if we ignore it, we'll be like that car, and then you end up at St. Dominic's, not at Dr. Quinn's office, but you're in the emergency room looking up at me, and you know you had a stroke, and now you can't walk anymore. Somebody's got to take care of you. So that's why it's so important, you know, to go get checked out. And I'm going to tell you one more story about a lady that came to see me. We're going to call her Jane. Miss Jane Doe. This lady came to my office in a wheelchair. Wasn't her wheelchair. They let her use it downstairs. This is when I was at my other office on Ridgewood Road. But basically, when I walked in the room, she was in the wheelchair, and her chief complaint on her chart was back pain. Okay, so as a physician, you know, I started asking the appropriate questions. How long has the pain been going on? And she said it's been going on for the last 10 years and getting progressively worse. So I asked her, you know, this pain is so excruciatingly bad, you're in a wheelchair, you know, what did the last doctor say? You know, have they done surgery? What's going on? And basically she said she's never been evaluated for the pain, but it's been going on 10 years. So immediately that indicated that she had not seen a physician in 10 years. Now this lady was about 58 years old, had good insurance. Husband worked for Nissan, but he was also a pastor. Okay, now what does that matter? He had good insurance, right? It does matter, because when you have insurance, you have no excuse. Because the insurance, you can go get a physical every year for free. Okay? You have your wellness plan. So I told her, ma'am, I said, can we just do a physical one? I know your back is hurt, you didn't come for that, but you know, family Dr. Quinn, you come in here, we're gonna check you out. So she agreed to the physical. Turns out her blood pressure was good. She didn't have diabetes. Everything was looking good. So we got to the physical exam, and we laid her on the table, and we started to do the exams. Turned out her right breast was hard as this podium here. I immediately asked the lady to, let's put your clothes back on, and we're going to send you down to St. Dominic's to get a MRI of your back. Turns out the lady had cancer that had spread all over her body. Okay? Now, to regress, another lady, about the same time period, came in to see me. Physical exam was requested, looked at the chart. Only complaint was patient wants a physical. So I walk in and, you know, she's got the same insurance. Both their husbands work at the same place, both the ladies the same age. And we do the physical, blood pressure is good, no diabetes, cholesterol is good, ladies in great shape. We do the physical, the breast exam, no masses, everything feels great. So I said, okay, ma'am, you're going to put me out of business. I can't find nothing wrong with you. I said, well, look, you just come back next year. And she's like, okay, doctor. I said, but you know what? We still got to follow up for that mammogram. No, I don't need a mammogram. You did the exam. You didn't feel anything. Everything was good. That mammogram hurts. I said, ma'am, let's do the mammogram. Say, it hurts, huh? Remember the first lady now. This lady was in a wheelchair. She was in so much pain because she didn't get the mammogram. The second lady goes to get the mammogram reluctantly. I get the report. I give her a call. Microscopic calcifications. That's cancer at the earliest stages. That's cancer before you can even feel it, or definitely you can't see it. Okay? So we refer the lady to the surgeon. He does something called ultrasound guided biopsy, removes the calcifications, and the pathological report shows that all the surrounding tissue is cancer-free. What does that mean to that second lady? She's saved. The cancer was diagnosed microscopically at the earliest stage before she ever developed one symptom. Removed, the lady was cured. They said follow up for a mammogram next year. Two ladies. Both ladies, the same history, same everything, except one lady decided that she didn't want to go get it checked out. If that first lady that had the cancer that spread all over her body, I say this with 100% certainty, had she have gone and gotten her physical, got the mammogram, caught the cancer early,